Welcome, everyone. Tonight's topic is one that a lot of people are talking about now, but even more people will be talking about in 2026. There are so many changes, y'all, coming to healthcare, and some of y'all are sleeping on it. But let me just go through a little bit of the changes to put things in perspective, and then I will introduce our lovely guest for this evening, who's going to help you manage some of those changes if you are willing to step outside of your comfort zone. And she's going to share more about that in a minute. But just a little bit about what some of the healthcare changes for 2026 look like. We'll talk about the main one: higher premiums. Higher premiums due to the expiration of enhanced premium tax credits. These are some changes that you may have heard about, but it's not just people on the Affordable Care Act. These are people who also have private insurance who will feel the effects of some of these changes. This is all part of the big, you know what, bill, y'all. So I want y'all to really, really understand what's at stake. And with higher premiums, that just simply means people will avoid, especially our people, will start to avoid doctors more because they don't want to pay those premiums. And that's not good. That should not never be an option. Um, Also, increased uninsured rate. So the expiration of the credits that led to millions more people being uninsured projects a potential 75% rise in premiums for these people as well. So the uninsured, rate is going to be impacted as well. Greater. That's kind of what I was talking about. Like, we are going to be less inclined to pay the premiums. We're going to be less inclined to have insurance because the marketplace premiums are going to be so much greater. And that's also going to affect Medicare. Y'all only want to talk about Medicaid, but it will affect Medicare because a lot of the Medicare benefits will be scaled back. So extra perks like, gym memberships, oh, those will be scaled back. Over the counter items that you used to can, you know, not you used to didn't have to pay for under Medicare, those will be eliminated as well. And also benefits and funds for you purchasing healthy food. There's so many more areas that Medicare is going to be impacted, including higher costs for parts B and D. Listen, what I'm saying to you guys is that we have to have options. We have to have alternatives. We have to plan. So if this does affect you or anyone in your family or anyone that you love, you are ready. We talked about Medicaid impacts on an earlier video, so I won't really get into that. What I do want to do is introduce our guest of tonight, who will share. I don't want to give anything away, but she will share some strategies, some tips on how she was able to save a substantial amount of money by stepping out of her comfort zone, as I talked about earlier. So let me introduce Andrea. Hi, Andrea.
Hello.
Andrea is going to also grace us at our Brunch and Learn workshop, which is on October 25th at 10 a.m. There should be a link to register if you're interested, but she's going to pull back the curtains on the real costs for getting healthcare in another country. That may be stepping out of your comfort zone, right? But she's going to peel back the real costs. She's also going to share trusted clinics and hospitals and what it takes to really navigate care overseas with confidence, with ease. Like, she's going to drop some gems during the Brunch and Learn. She's going to, give some insight here as well, but she's really going to get into the details during the Brunch and Learn segment. So, Andrea, do you want
Yes.
to say hello to the Gym Nation?
Hello, Gym Nation. I'm so happy to be here. You may have seen me before, but I'm sharing another bit of my story with you tonight.
Yes, Andrea and I have partnered on multiple occasions to bring as much information as possible to our audience, which is often the last to know. Like what we're about to talk about tonight has been happening outside of our community for decades. We're kind of like the last to know and get up on this whole medical tourism. And so let me introduce myself and then I'll get into the first question. Hey everyone, what's up? I am Kim, aka Kim with the Gems, and on this channel, we talk all things wellness, travel, and money, honey, all in an effort to empower us, all in an effort to allow us to do things that we may not have done in the past, but we're going to do it because we have a community showing us how to do it. And Andrea is a big part of that community. I will ask that before we start, go ahead, subscribe to this channel. We are on a quest to get to 50,000 subscribers before the end of 2025. And there's a reason why we need to think big. We need to get to that number. And if you haven't seen it playing out in real time, then I don't know where you've been, but I will just say community is going to be necessary for the foreseeable future. It's always necessary, but it's going to be even more paramount for the months, the years to come. And so hit the subscribe button, go ahead, like this video, do it now so the algorithm could do what it needs to do and hopefully let more people who's just like you join this conversation. If you have questions, feel free to put them in the chat, but do me a favor, put a Q in front of it so it just makes it easier to spot and turn on notifications. Listen, I'm hearing from all types of creators, content creators on YouTube. People are not getting notifications, but go ahead and turn it on. Try your luck. Hopefully you'll be notified the next time that we go live. So without further ado, we're just going to start off with a real easy question, but to kind of set the tone for this conversation. Andrea, I know that you traveled abroad recently for medical care, and I just want to know what made you even consider getting medical care outside of the US?
Yeah. So, spoiler alert, I went for dental care, and I shouldn't really be flashing because I'm not done. So I have what you would call a problematic mouth. I've had problems forever since I was in elementary school. I had braces when I was in high school, and I think I started them in junior high school actually. But my father, who was a civil servant, lost his job, and so the braces were just hanging out on my teeth. They were just hanging out, and it's funny because one of my good friend's brothers, he made fun of me, and he said I would do this whole time, right? So I push my glasses up and move my braces because they were loose for years, so much so that he could mimic me. Anyway, so I had um, what do you call it? Crooked teeth. I went to college with crooked teeth. Um, and when I was after I had my son, a grown adult, and had I bought my first house, my first property. I took out a home equity loan and got my teeth fixed. Um, and that was over 25 years ago. Ooh, don't start doing the math. So now fast forward, it's time to do some stuff over. It's time to remodel. And I go to the dentist, and my dentist, who I had been with forever, remodeled. He did the first generation, but he doesn't take health insurance. He doesn't take insurance because, dental insurance, typically they will give you very low reimbursements. And typically there's like a max out of pocket, like $1,000 a year. They'll cover maybe one cavity, maybe two cleanings. Dental insurance doesn't really do that much. And my dentist is like, I'm not doing all that work because it's a little bit of money. So you can fill it out and have them reimburse you, but you're going to pay me what I need to pay me. And it just became very expensive. So I went to one of these places that you see on TV, and they're like, come in and we'll, create a package or do whatever. But what they don't tell you is that it's expensive as hell. And you basically have to sell a body part, mortgage your house, or take out a loan to get the work done. And so they're like, don't worry, we'll help you finance it. I'm like, I don't want to go into that much debt. And I'm talking about like luxury car debt. And I was like, I don't want to do that. Go back to my dentist. And um, he's like, you got to do something because you have several infections. And I didn't realize how close your upper sinus cavities and your teeth are to your brain. So I went to a conference in DC, and the executive director of the National Dental Society was there, and he talked about two cases where people had infections in their teeth. It seeped to their brain, and they died. And I said, I am not going to die from a dental infection. So I go back to the place, and I'm like, okay, what's the quote? They gave me a quote, and I'm like, I can't do that. Can you imagine, like, you have to have a dental procedure or any procedure, a medical procedure that could be life or death if you don't take care of it, but you just can't afford it. So that's what I was faced with, and that is why I went.
Wow. So you have literally been struggling with this problem basically all your life. And for us to be in a first world country, you would think that dental care would not be so preventative that without spending, like you said, the amount of a luxury car, you'd be able to get this taken care of,
Yeah,
especially what you know now about other countries and all the research that you've done. Like it just seems so unbelievable
it's
that,
unbelievable.
like you said, and just a quick, you made me spark a thought or a memory. Actually, I remember going to the dentist, and they did did my biannual cleaning, which I think should be more often. But anyway, they did my biannual cleaning, and the dentist, who was a doll, was like, okay, you need to get the deep cleaning, right? It's time for the deep cleaning. Every senior person I know in my life has had the deep cleaning, right? She puts in the request for the deep cleaning, and they rejected it because it was like 1/2 of a quarter centimeter not deep enough. Whatever they said, the plaque buildup, it's supposed to be like a 1/4 inch deep or something like that. And they were like, it's like
1 millimeter.
1.3 quarters or
Yeah.
1.22, whatever the number was. And she was like, let me try this again. And they declined it again. Like, so they want you to be literally at the worst point before. And then I guess it's all subjective, right? So if one dentist looks at the x-rays and they show one thing, another dentist could see something else. So it's just such an antiquated process, and one that is just riddled with capitalism, as we can tell. So
And and as important as your mouth is, people think, oh, your teeth are jacked up, it's cosmetic, or you have bad breath, it's vanity. Dental, your mouth is the gateway to so many um, other areas. Let's just put it that way. And I'm no clinician, but there's so many things that could go wrong if you don't have good dental health. Um, and there's so many um, ways that you can detect other problems early if someone is in your mouth often, which I also didn't realize.
mhm.
Um, so it's very important to, I mean, I'm gonna say everybody knows how important it is to take care of your mouth, but it's sad how many people have issues that they aren't able to address just because of affordability. And even kids, you see
Yeah.
kids who have metal all in their mouth. I mean,
Yeah.
so it's not just old people, it's not just poor people, because, I'm no Saudi princess, but I work, and it just becomes unmanageable.
Yeah. It is, uh, again, something that I think so many other people knew about, like just knew the solution for avoiding those exorbitant costs, but it's now just really seeping in to our community, and it's still a slow seep. It's not like a waterfall, it's a slow seep. And so I'm thankful that you're exposing your personal journey.
Yeah.
um, I know, from some of the other conversations that we've had, but and I was quite shocked. And I think I may have had my mouth agape when you shared exactly, how much you saved without telling, official numbers. Can you put it in percentages? Like, can you give
Mhm.
us a insight? We're going to get it more into details during the brunch and learn workshop, but can you just give us a top line
Yeah.
summary? How much you?
I want to just look something up real quick. I just want to, I'll tell you how much is a BMW 3 Series. Just curious. Let's see. Okay. How much is a BMW 5 Series? Really quick. Um, just a quick search of Chat GPT. Okay, so let's say uh, BMW 5 Series. They need to do that amount of work. So let me just say this. A lot of people have teeth missing, and one prominent public speaker said, "Ain't nobody looking for that tooth. You don't have to worry about that tooth." But when you miss, when you miss one tooth, if you don't have an opposing tooth, you can lose the other tooth. So a lot of people, especially like old black folks, I love old black folks. Oh, you don't chew on the right side. You don't need that. So um yeah. So anyway, what they recommended for me for cosmetic, not just cosmetic reasons, um, was a reconstruction that was on the level of a new BMW 5 Series. And so I could not afford that. So then I started researching, and I don't know how I came across it, but it was probably Facebook or something like that. I probably mentioned it, and then the universe started serving up ads. Oh, and no, I saw it on television. That's what it was. I saw an ad on television, then I went over. Anyway, um, after all my extensive research, and I looked in Mexico.
Well, we're
I
gonna we're gonna get into that, Andrea.
Okay,
Just the percentage. Just give us
okay,
like percentage saving, because I have questions about
okay.
that.
All right. 25%. It was 25% of um what I was
You were
quoted here.
quoted here. Okay. So let's just put that into simple terms. If you were quoted $100 here, you literally paid $25 for
Correct.
the procedure that you needed. And
Correct.
let's say if that number in fact was $10,000,
Hmm.
you paid 2,500.
Correct.
Okay. Whoo! So I just want to underscore y'all. 25% of what the quote was here can be substantial. I'm just going to read something to you that I found online, somebody who was looking for alternatives. Someone who was quoted between $7,000 and $8,000, and that is with them having some semblance of insurance, right? So whatever their insurance was going to cover, the out of pocket was 7 to 8,000. they were able to go abroad. I'm not going to list the city yet, or the country yet, and got everything done. And this is without them having to show an insurance policy for
Mm-hmm.
under $2,000. So think about, and more,
Mm-hmm.
excuse me, it was more than what. So I don't want to get into the details, but they needed 2 root canals, 1 molar and 1 premolar, 2 fillings, and then some like the cleanings and all of that. And so they paid under $2,000. And that, oh, excuse me, that included their flight there and back.
Yes, that's what I wanted to share. That my 25% was not just for the care, the dental care. It included 2 round trip tickets, two, five, let's say 5 day stays in a 4-star resort, transportation to and from the airport, and transportation every day to and from the clinic. So yeah, it wasn't just the clinical, and that was still less than 25% of what they quoted me. Yeah.
Listen, even if you have insurance, like the person that I just gave an example from, the fact that you can leave a country, get housing, and like Andrea said, they usually bring you to and from your appointments to make sure you're okay in other countries. To be able to do that for literally 25% of what the US charges, it's just something not right about that. And we're talking quality places. But before we get into that, just give us a quick reaction from your friends and family, or a friend or family member when you were like, hey, guess what? I'm leaving the country. Because I
Well,
know initially you were gonna go on your own. You were about
yes.
to be out of here and go on your own.
Yeah. Now, mind you, I went in March, which was right after a significant event in the United States
Mm.
where people felt insecure about traveling outside of the country. And um and I went to a part of the world that's not easy to get to, and that's not very familiar to people. So first, people thought I was joking. Then they thought I was exaggerating. Then they thought I was crazy. And then they were like, scared. So the reactions ranged. Um, but I I was going to go by myself. And I felt comfortable for a lot of other reasons, which we may get into, because of the research that I had done and the connections that I had made. But I ended up not going by myself. A friend went with me, and um, it worked out well. But also, I want to say that, and you touched on this a little bit. I don't want to make this sound like it's all cheap, 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 cheap. Because one, I didn't go to the least expensive place that I found. I didn't, because quality is important to me. Um, I also felt very comfortable with the quality of care that I was going to get, and in many cases, um, exceptional. I had seen evidence of the work, and I know that I could check credentials, and I don't feel like Americans and American universities are the only place where people are trained well. I just don't have that worldview. Um, and when I learned about, listen, you know, I don't know how many generations ago, my mother, let's say my grandmother or my great grandmother, they would go in the field, squat, give birth, and get back to work, right? Now they do something pretty similar. You go to the hospital, you have a child, and they want you out in like 2 days. It's, and they will you out because of liability reasons. But after you get to that curve, they may as well just turn that wheelchair over and dump you out. Um, when you think about concierge medicine, which is not even a concept that I had heard until recently, When I thought about the clinic picking me up from the airport, like, why would you do that? When I thought about the fact that they would pick me up from the resort every day and take me back and forth to my dental appointments because they didn't want me traveling in a place that I didn't know, they didn't want me um, to be concerned about being impaired because of anesthesia or anything like that. When they sent a Mercedes Sprinter, right? When they had the driver take me to get my prescriptions, like that's a level of care that is above and beyond. So I'm not talking about just being cheapy cheap. I'm talking about quality experience, quality care, what care really should be. Care, full care, concern.
And at a fraction of the cost. And there's just one thing I want to share before we get into your questions. Again, if you have other questions, please go ahead and put them in the comments. We're going to go through as many as possible. Today is really just a top line conversation, just to let you know what's possible. But if you look at what the rankings are, right? How does the quality of the US health system compare to other countries? I just want y'all to see. And this is across most reports. So we're not going to go through the whole thing, but it says despite spending nearly twice as much per capita on healthcare compared to similarly large and wealthy nations, the US has a lower life expectancy than peer nations, and the gap has grown for some measures since the panorama.
Hmm.
There's a whole chart, but generally the US performs worse in long-term health outcome measures such as life expectancies, certain treatment outcomes, such as, and we all know as Black people and women about maternal mortality rates and congestive heart failure hospital admissions. And I don't want to keep going because I want to have more time with Andrea, but we have, for us to be, what did they say? For us to, as a country, spend nearly twice as much per capita, we have a higher mortality rate overall. Like we're not living longer because we're spending more. And so that's just something to think about as we are planning what's next for our futures and having a plan. And so getting into another question, let me go ahead and stop sharing that. Perfect. I would love to know from you, Andrea, based on all of the research that you've done, um, and you could talk about other countries, well, not specifics, but talk about some of the other countries. But why is it important for people, especially us, right? Especially Black Americans, to know about these options and that these global options exist and that they're accessible to us too? Like they're not saying no Black people, no,
Right,
so why is
right.
it important? Why do you think? Outside of just the cost, of course.
Yeah. Well, because our health outcomes are worse. So that data is for Americans generally, but Black Americans' health outcomes are worse. I told a story recently on my LinkedIn page where I went to the dentist and because I've had tooth issues forever. I said, "Oh, I'm having dental pain, so it's either going to be a root canal or an extraction. So let me just go to the dentist and take care of it." This is a different dentist because you know you have to see a certain specific kind of dentist for this stuff. So I go to a new dentist who doesn't know me, and I'm like, "Oh, I'm having pain. So is it going to be like a root canal or an extraction?" He goes, "Well, I'm gonna tell you right now, I'm not giving you any drugs." I said, "I didn't come here for drugs. I came here for a solution." Um, a root canal or an extraction. But if I need painkillers, you know, I I expect that you would give whatever is appropriate, but I didn't come here for drugs. I came here like you can see my face is swollen. I came here, I was so upset because of the implication that I came because I was drug seeking, not
Mm.
because I wanted to take care of the dentist. Do a freaking x-ray and you can see that I have a real problem. I take some Tylenol. I don't care, but I want to solve the problem. Anyway, so you don't have that assumption that you're drug seeking. And then also, they have a different um, attitude about preventive health because we here treat problems, we treat issues. We don't spend money to stay well. Um, and so other countries have different philosophies about that and will. So there's some tests that even if you want to get and pay for yourself, they won't give you because they don't believe in wellness. They don't think about it that way. Unless you have a symptom or an issue, you're not getting that test. You're not getting a treatment. You're just not getting it. And a lot of times they won't even give it to you if you pay out of pocket. So it's access as well.
Mhm.
Access, quality, outcomes. I also, in my last mammogram, went um, into the room to get a mammogram. I took my shirt off and my bra off, and the woman comes in. She goes, "You have a copay." I'm like, "Excuse me, I'm naked. Get out. You will get your $45 when I finish. Like, get out of here." And I mean, you're treated like a criminal, like and so I'm just saying, I had the exact opposite experience, and there's all of those reasons in addition to the cost, right? Better quality care in a lot of cases, better outcomes, preventive care, better treatment. It's just a lot of reasons that it's worth considering.
And I will even add, if you are aging or of a certain age, the type of respect that is given in many other countries that is not given here anymore. There used to be a time, right, where if you were an elder, that meant something. Something as simple, if you get on a bus and there's no seats available, somebody's going to get up, right?
Yeah,
Well, as someone who lives in New York, I could promise you that is no longer the case.
yeah,
Absolutely not. And many other places, whereas in places like Mexico, or even Panama or Ecuador, I remember hearing about. If you are a senior, not only you there's a whole section, right? That's your section, and no one's supposed to sit in that section. But let's just say there's someone sitting there, there's no hesitation with them getting up. Or if you're in the supermarket, you are allowed to cut lines, right? It's not even called cutting lines. It's respecting your elder. Like they shouldn't be standing on a line for 40 minutes. Well, it's the same as far as healthcare is concerned in many other countries. And so that's the type of care that many of us have never ever experienced, right? And I'm also now bringing it to race because a lot of times we feel like there's a lot of isms that happen in the medical field here, that are, I won't say non-existent because I can't speak for every place, but less existent than what we face here. And so again, it's something that I want you guys to really have as a plan B, another plan, because Andrea talked about a $45 copay for her mammogram. What about when that copay is $300?
yeah. Or
And I'm saying that with a straight face.
and what about when you need a test or a shot? Listen, let me just say, I'm not a conspiracy theorist. I don't want to call anybody names. I'm not a crackpot. You won't feel triggered if you don't identify. Um, I work in healthcare, right? I support the healthcare industry. I've worked in pharmaceutical biotech. Um, I believe in medicine, and I just think our healthcare system is broken. My doctor, my dentist that I talked about, I stayed with him for decades because he did treat me well. it just at some time point became inaccessible and too much. And you have to make trade-offs. And a lot of times when it's optional, your health sacrifices. It can wait. It can wait a year. It can wait 2 years. And I've seen what happens when people wait. I have a friend whose sister got a diagnosis and she just decided to wait. And, unfortunately, her diagnosis moved faster than she moved. Um, you can't take chances, and sometimes you don't have time, and sometimes the time and your money don't align, and you're making impossible trade-offs. And I couldn't do it.
And let me just say, you do not have to be a conspiracy theorist to know that this system is broken, because every educated or every what can I say? Because now the news is so questionable, right? So every reputable study says the same. And so I just want to show you real quick, another, you do not have to think it's you. It's not you. It's not you being a conspiracy theorist. The Washington Post, 2011, the US healthcare system ranks last among 11 high income, I'm sure it's countries, but there's another one. That's an opinion. US ranks last in healthcare compared with 9 other high income countries, I'm going to say is what I said. U.S. healthcare ranks last compared to 9 other countries. U.S. healthcare, from a global perspective, is saying that, again, if you read through it, because I was going to pull that up first, that we rank very far on the bottom of the list. Dead last, the U.S. healthcare system continues to rank. Like, this is not us fear mongering. This is not any type of um, conspiracy theories. This is real. And it's not going to get better, because what we are seeing, these doctors are burnt out. These doctors, especially now with the changes to insurance, are going to be leaving and only focusing on the high net worth individuals that can pay out of pocket, because it's not worth the headache to them for them
Yeah,
to get denied um, their insurance requests, and then still have to serve, right? And
yeah.
so it's,
I
again,
I have
it's
to make some disclaimers.
mhm.
Those headlines and what we're saying doesn't mean that the doctors in the U.S. are inferior. That's not what
No,
it means.
no, no, no,
It
no.
it doesn't mean what it means is that the system, the way the doctors interact with insurance, that
Yeah,
interact with um, the hospitals or the care centers, that interact with the pharmaceutical all of that stuff. It's the system that is broken that ranks last, not the clinicians themselves.
I 100% agree, but I would like to put a asterisk. We all heard, and I think I brought it up on a live before, about, was it the dentist that laughed about how she wants Democrats to be in pain? How I think she's a staunch 47 supporter, and publicly in a forum with cameras laughed about how she loves to inflict pain on Democrats. Now think about that from a perspective of where you live, right? What city you live in, what state you live in, what type of stories and messaging you're hearing in those areas, because I do know it's going to get worse before it gets better. And it's not the majority of the doctors, but there will be some doctors that we just don't know, you know, what their goals and objectives are. So again, we're coming to you with this in a timely way so that you can start doing your research, so you can start seeing if I needed to, right? Or at least I have a list of these facilities, et cetera, et cetera. But let me get back to another question for you, Andre, before we lose, well, y'all lose me because I have to run in a few. Um, but I would love to know, what do you think the biggest misconception is about getting medical care outside of the United States?
That the doctors are inferior, that the clinics and the hospitals and stuff are dirty, uh, that um, yeah, I think that the experience will be inferior, and that the doctors are inferior, that their training is inferior, and that the facilities are inferior. They're just not comparable.
Yeah, I agree. I agree. And the reason why Andrea is, and I list her as an expert in this field, is because, as she mentioned, she works in, and can you just share a little bit about, what you do, Andrea, so
Yeah.
understand?
So the shorthand is I'm a headhunter. I support healthcare and life science organizations in identifying top talent, um, which includes doctors and CEOs of hospitals and pharmaceutical companies and things like that. So I know that they're talented, educated, capable people. That is not a question.
Mhm.
Um, and I have worked in hospitals, and I have worked in pharma companies. I've worked in biotech companies, the companies that make the drugs. Everything from the scientists to the medical directors. Um, I have confidence in the talent that this country produces. It's the system that's the problem.
Yeah, so coming at it from, both angles, someone who sees, from a top level what the requirements are for these doctors, or these they're not all doctors, right? So they're executives, should I say, at the
Mhm.
executive level, in the healthcare and medical fields, and also deciding to step out, right? to do something non-traditional based on the research that she was able to spend time putting everything together, because where she ended up, and we're not going to get into the details of that, during the brunch we're going to get into the details of where she ended up, the specific venue, why she ended up there, but she had researched multiple countries, and so understanding that she has insight, and then still opted right to have her medical procedures done abroad, is it's telling. And it wasn't all, listen, you can say something's 25% less, right? But if you are not going to get the same quality care,
That's right.
if
That's
you
right.
are not, if they're just going to take a hammer and nails and do what they got to do, then it doesn't make sense to get it done. So I see there's some questions in the chat. Before we get to those questions, before I ask my next question, I'm gonna get to those questions. But I just want to remind everyone that on Saturday, October 25th, it's our Brunch and Learn workshop, which is titled "If We Can Move Abroad, You Can Too." But understanding that even if your ultimate goal is not to move abroad permanently, what options, based on everything going on in the world right now, what options does abroad offer you, right? And one of those is quality medical healthcare at affordable prices. And when I say affordable, we know affordable is relative, right? I'm talking to people who may have, some big ticket healthcare expenses. And as we age, we know those become more and more frequent, or they're likely to come more and more frequent. I'm not putting that on nobody.
Yeah.
Um, but they're the average, or the odds are that there could be one major event that can wipe out your savings. And we don't want that for anyone. So on Saturday, October 25th at 10 a.m., the Brunch and Learn series, we will cover not only how to move abroad in the most efficient way, and we're going to take you through all the lessons we learned in Panama. I mean, from Panama to Mexico and Ecuador, but we're also going to talk about healthcare abroad, which is really, really going to be more important. And so let me get to just some of the questions
Can
that
I
we.
just say one thing before you ask this question? One quick
Sure,
thing.
sure, sure.
I know we're talking about wellness and taking care of ourselves and healthcare, but I don't want to neglect my cosmetic girlies because you can also there's no reason to be looking ugly. That's all I'm gonna say. You don't have to be ugly.
Yeah, we're going to talk about all of that during the Brunch and Learn series because I mean, it could be something as simple and quickly, like let's talk about simple. Who, like, if you don't, let's just say, God forbid, you're one
Mhm.
of the federal employees that have one of the 300 plus thousand federal employees, well, now 700,000 collectively or 800,000. Anyway, if you're one of those and you lose insurance eventually, would you rather spend $300 to get your teeth cleaned, which those probably will go up, right? That number, I'm just giving a decent um at a decent facility, $300 for your teeth cleaned or $60 for your teeth cleaned. All things, everything else being equal, right? State of the art place, qualified doctor. You could do a whole vacation for the cost that it may take for you to get work done, and also cosmetic work. We'll talk about that during the Brunch and Learn. But just one wants to know: do you anticipate any concerns with care here in the future?
I do. Um, I mean, you could just watch the headlines, right? There are going to be issues with supply chain, with access. So, all of what I just said, where do you think our medicines are manufactured? They're manufactured in the places that we're beefing with. Um, our needles, our um, all of that stuff.
Can I ask
Um,
you a question? You talked about medicines. What are your thoughts about Trump RX? Or do you have any thoughts about him getting into the pharma game?
I have no thoughts.
Okay.
And I think you have an intelligent audience that can make decisions for themselves. I like my medicine to come from medical people.
And that she picked up what I was throwing. Exactly. It to me, question mark. I'm not, I'm not a PhD or nothing, but just doesn't make sense to me. But go ahead. Did you have anything else?
Oh yeah, so in healthcare, yeah, I mean everyone's anticipating changes. Um, you can look at the fact that how many scientists are leaving the country. You can look at the fact that uh, other countries know what's going on, so they're recruiting scientists from here because they know that their research is being suppressed and not supported. You can look at the fact that we have no body to regulate the drugs. So when the drugs, who's going to approve? We're letting those people go. The organization that funds research, um, the NIH, the FDA, the CDC, the organization that's supposed to protect public health. So if we're dismantling these organizations, what do you think that the future of healthcare is going to be here?
Hence why the earth, listen, not to fearmonger, just to have you prepared. It just makes sense to have plans. in case you need them. God forbid, you know, God forbid someone goes to the doctor in December, right? Under one healthcare plan, only to get information for treatment and or services that they need, but can't start till 2026. And those costs are cost prohibitive for you to get those treatments. It's just, it's better to, because guess what? They planning, they are planning. And you could read between the lines what I mean by they. Hey, Jackie's Journey. Jackie's Journey will also be one of the experts who is part of the Brunch and Learn series. Listen, let me just announce the code. You missed the $50 off. We have a $25 off code that expires this Saturday before it goes to the regular price. So go ahead, sign up before, this Saturday. Did I say Saturday? The 18th. But Jackie's Journey is going to share all the gems, all the insights about how she was able to move her and 9 others in her family to Panama with all the changes, with all of the new regulations, but how she was able to do it and how you can too, if that's what you're interested in, and more about Panama. Christine says, Andrea, would you consider living in the country where you received your care?
That's such a great question. It would not be at the top of my list, but I would not live there. I have some other locations that would be um, higher up. Uh, I saw another question.
I'm
What
going to
that
get to
follow-up
it.
thing? Okay.
Yeah. So I think she, and I think this is part, so I'm going to read both of them. Do you expect problems with follow-up? Do you expect any concerns with care here after international treatment? I was told by the billing person in my dental office that they would no longer treat me if I had care in another country.
So, do I expect problems with follow-up? No. My dentist would probably be opposed to me uh, seeking treatment outside the US. I've heard others say the same thing because I don't want to be liable for that work. And okay, so let's say somebody moves here from China and goes to the dentist. Are they going to say, I don't know what you had before you got here. I'm not going to treat you. No, they're going to treat you. Um, your dentist has, incentive to prevent you from going overseas. Because once you experience what I experienced and then come back to this at that price, it's, how they say, once you go black, you never go back. It's the same thing. So, of course, they're going to discourage you.
Right.
So, no, I do not anticipate problems with follow-up care because if I go, so how are they going to know where I got my stuff done? They won't know. There's no, I don't have a big, gold tag in my mouth. No, I don't expect any problems. And the thing about it is I do get free follow-ups there. So I could always go back there for an annual trip if I wanted to.
And what kind of care provider says, I will not treat you if you go abroad? And so, what kind, where is the care? Where the heck is the care in that company? Like, that is I would have to reconsider, I have to, if you love them, fine, use them till you don't need them anymore. But that is very telling for someone to come out and say that to you. I know, listen, I've been dealing with contractors for the past couple of years. They all say the same thing. If you hire somebody else, I'm not going to work behind that person. I don't like, And guess what? You hire somebody else. If it don't work out, you call them. They are there because they want the check. They want the, so again, that's fear mongering, right? If you want a clear definition of fear mongering, that's what it is. Hey, Cynthia, I'm going to say hey to other people, but let me just see if there's any other questions. In South Carolina, healthcare professionals can reject patients for any reason. Yeah, I think that's going to be the norm. Like, I think absolutely. And
that is the direction, that is the direction they're going. If
yes,
you are LGBTQIA, if you are Black, if you look like you're a drug addict, which don't have a cold, um, it's just,
if
you
you're a
know,
Democrat, if you are a Democrat and they know that you're a Democrat, he's even spoken about that. Like, this is not just South Carolina. This is about to be so ingrained in our society for the foreseeable future, based on the people he's putting in the office, based on what the objectives are. And so again, just a more urgency to get a plan together, right? And again, if you never have to use it, God bless you. But don't have it waiting till the last. Listen, I have a folder where I have, and I think presented it during one of my lives back in November or December, where I have a list of countries and the estimated cost for healthcare for everything. So listen, I ain't having no babies, right? But I have, just in case. So if a family member, a loved one is like, okay, I live in Georgia, they're tripping, they're saying blah blah blah, I'm like, you know what, let's look up this country, here are some facilities. This is the type of planning that you want to have, because you don't want to wait until the last minute. And
yeah,
so a couple more questions, then I'm gonna let you go on. Well, if there's no more questions from the group, so get your last minute questions in now. But I
I
do
just
want, go ahead, you
I
see
just want
another.
to tell a story. Can I tell a story?
Okay. Let me ask this question first, and then we'll
Okay.
get to, okay. um, so I want you to share. I'll do the two-parter. Tonight was an overview, and then we'll get into your story. So tonight was a taste of your experience with healthcare abroad. Can you just share like a couple points what people will expect in addition to what you shared tonight
Mhm.
during the Brunch and Learn workshop?
Yeah. Well, I will take you through the intricate details of my process, how my research, my sources, my thought process, my plans, my contingency plans, what I experienced in country, what I experienced since leaving. Um, I can share some numbers, and I will even share some pictures. Because I think it's important. It's one thing to talk about something in the abstract
Girl,
form.
it's a brunch and learn. We gonna be eating and drinking. So.
No, nothing disgusting. It's not
Oh,
going to be.
okay. Got it. I didn't know if they were pulling or yanking or whatever. Go ahead,
No, no,
because
no.
I know
I'm
you
just
said
talking about. I'm just
not.
talking about before and after.
Got it. Okay, perfect.
Yeah, yeah. Um. So yeah, I just because I know people want to know. Like So you need to know that level of detail. Um. Was that the answer to your question?
Comparative, like, are you gonna? Because I know you did some research for
Yeah.
some other cities
Yeah.
that you were
Yeah.
thinking about. Just the,
Yeah.
it doesn't have to be detailed, but I think you're gonna talk about the difference in prices because you went where you got the best deal. Well, best deal with good quality, right?
That's right. It was a quality and cost and aesthetics. I felt like I would have the best look to the best outcome.
Yeah.
Yeah.
And then finally, um, well, you kind of answered it, but in your words, because I think I did most of the talking on this, but in your words, can you share why do you think like now, like this is October 2025, why do you think it's the best time for, or at least the right time for people to start exploring healthcare options?
When I went in March, I was like, am I going to be able to get out and get back? I felt like it was March 2020. Well, March 2020, I lived in one state and I was moving to another state, and they were talking about shutting down the highways and everything. I was like, am I going to be able to get out? Am I going to be able to get back? Is something going to happen while I'm over there? Is something going to happen while, you know, um, they say don't put off until tomorrow what you can get done today. You know when the best time. This is gonna sound crazy, and we can talk about it. And, fight me if you want to, but I'm gonna stand on it. If you're unemployed, go,
Mm,
right?
mm.
Because you have time. If you have vacation time, go. Because what you don't want to have happen is you don't have the option. And there were some things that I should have done during the pandemic, and then I'm sitting down in lockdown, like I can't believe I didn't take care of that before, and now I can't move. So I'm not predicting anything other than we know what's going on, and you never know. And if you have an issue, take care of it. Which leads to my story. Can I tell my story now?
Can I just ask? One person has a question. You're at a conference Wednesday through Sunday. Will there be option for a replay? Absolutely. There will be option for a replay. There will be options for you to get in touch with whichever experts you decide to, reach out to after for more clarification. So yes, there will be replays, and hopefully it won't be. um, the replays will be pretty immediate. So if you're not able to make it, whenever you have time Saturday night, you'll be able to watch it. So yeah. Okay. One more question. I'm sorry. Somebody else said, are you able to get major medical work and procedures done abroad without being a resident of that country? Hey, Tay or Ty.
Yeah. Yes, absolutely. Um,
You just needed, what did you needed a visa, right? To get in the country. Did you need a visa?
I didn't need a visa, no.
Which brings us to the last point before Andrea gets into her story. Listen, y'all go down my history on this channel, including a week or two ago. The visa rules are changing. Your the process is not going to be as seamless for a lot of places come 2026. Well, it's already started in 2025. And so right now, there's still many of the countries. Andrea did not need a visa to get into. She did not have to pay to enter that country. So now, if that's the final point as to why now is the time, and why, we pretty much are so urgent about getting this message out. And that even means if you're looking to bop around, if you're looking to move
Mm.
abroad, things are changing at record pace, and now is the time. Okay, Andre, your story.
Okay. So I went to where I went, and I stayed in a hotel. And let me just say, without giving away too much, that when I saw somebody else that was melanated, we were like, okay. So I talked to a woman that I saw there, and asked her why she was traveling, and she said she was also there for medical tourism, but she was there for one of the total body scans where they do a diagnostic, and we can talk about that too. I don't want to get distracted. Um, she had been having abdominal pain, and they told her it's just fibroids. Oh, it's just your fibroids. And she said, I don't know. Something doesn't feel right. I want to get checked out. So she went and she got her whole, she got the MRI, she got everything checked out. And and I said, oh, well, good for you. Asked her how much it was. We were talking. Her husband was there. And at the end, I said, well, I hope everything's okay. And she said, it's not. And so they had been telling her, kicking the can down the road, girl, that, you know, take 2 Tylenol and, you'll be fine next month. And it wasn't. It was something much more serious that needed to be addressed ASAP. And they were just telling her, it's just fibroids. So I'm saying all that to say that some things can't wait. Sometimes you have to, get, go with your gut. And we know it has been documented how dismissive the healthcare system is of Black women and their pain and their issues. They don't think we know anything. So there are opportunities for you to take your health and your beauty into your own hands. It's accessible, and And I'm not talking about, well, safely, quality, inexpensively.
And I would just like to add that if you pay attention to the projections that this country is very clear about as it relates to all types of serious diseases, the C word, the all of the things are there's a line, right? They're expected. Okay, yeah. Can y'all see this? They're
Yes.
expected to go up, dramatically. So, like now, what is it? Unfortunately, it's like 1 in 4 women or 1 in 5 women will be diagnosed with BC, breast cancer. It's Breast Cancer Awareness Month, so I definitely want to call that out. But in their lives, and Black women disproportionately so, and all of those numbers are expected to rise. Imagine you not being able to, even if you have insurance, like some of these places, the quality of care is so superior. Some of these countries, I should say, for a fraction of the cost. If you can't afford to get a second opinion, if you can't, like your, unfortunate, well, I don't know her her final diagnosis, but the fact that she was take 2 Tylenol, call me in the morning for a long amount of time, and I've seen that happen so many times with people, our people specifically. Why not have a plan B, another plan, have another plan? That's why the bit.ly is called Have Another Plan. It's not saying you're going to have to use it, but it's all about having another plan. And so let me see, are there any more questions? Hey, Moni, good to see you. There was something I saw earlier. Hold on a second. I don't know if it was a question. Um, oh, somebody mentioned about Florida took fluoride out of the water and kids will pay parents cannot afford dental care for major kidney decay.
Yeah. And as someone who's had dental issues since they were young, I'm going to tell you something. Those little baby teeth will fall out, and maybe hopefully they'll come back in, and then you can say, okay, now I'm going to start taking care of these real teeth. I'm not going to pay to take care of these little teeth that are going to go away anyway. But you might pay for the um, low self-esteem that the child suffers from. You might pay with the therapy that they need from being called snaggletooth and all the other names, and the low self-esteem and all that other stuff. So um, nobody cares about that but mom and daddy and granny and grandpa, right? The folks in charge don't care. Um, but they don't even care about the water quality, if the water is lethal or not. So they don't care about the way that you're getting fluoride for your teeth. But I'm just saying, sometimes you have to make the priorities, and you have to ask, how can I do this? And be creative about it.
And I just like to say that once again, we're just the last to know these things. I remember being in Bangkok, Thailand in 2018, met this senior couple at the airport. They were coming back from their 2 weeks in Bangkok, which they do every single year. Now they both have they had Medicare, um, and they still came to Bangkok every year to get the imaging, the thorough, and they said the hotel they stayed in, they treated them like it was the Ritz-Carlton. And for each one of them, it was under 2,000. I think they stayed like 6 or 7 days because they had everything, as they say in the South, from the rooter to the tutor checked out. And it was all high quality, state of the art. And for both of them, I want to say each one was $1,200, but again, this was 2018. So, and understand the prices in other countries, they're going to see the influx of people and they're going to pivot as well. Prices won't be the same. They'll still be, I'm sure, more affordable than here, but the prices will not be the same. And so they have been doing this since they retired because they did not like the healthcare or how they were treated or brushed off. Oh, it's a pain. You have arthritis. Oh, and you know, they will discount you. Like it's IBS, it's arthritis, it's fibroids, it's this or that without doing the extra work. And they always said it was like insurance. That was their insurance, right? And they felt that they got more care in a whole nother country than they
Yeah.
did in the country that they lived in.
Well, I told you what they said to my father in South Carolina. Said, well, you got to die of something.
Oh, that's right. That's right. And child, South Carolina is number what, 50 on the list of places with the worst healthcare in the US. And so trust me, that's where I've been through it and I've seen so much. And I actually speak to people who helped care for my mom who are no longer in the healthcare field because they went in for one reason and they started seeing changes. It just became more and more about the insurance, the numbers, the money, and and that and the like. So again, somebody was saying that YouTube, and this is weird because I see the number of people, and this has never really happened, but somebody was saying YouTube was out. A couple people said they tried to log on and they got error messages. So again, it may be the conversation, it may be the thumbnail, it may be just like just one said her doctor was like, if you go abroad, we won't see you again. YouTube may be like, you're telling people to go abroad. And that's not what they want us to do. So I ask you to go ahead and share this information with your loved ones. You could come together as a family to the Brunch and Learn series and ask questions. So I know so many of us are part of the sandwich generation. You have your parents, you have children. What could that look like? Sit together, start having the conversations, and hear real life stories like the one Andrea is going to share in greater detail about her journey with healthcare. I will share a little bit just about my experience in Mexico. And again, it's going to be very little. It's going to be part of my move abroad conversation. But just the difference in prices, the difference in just the human experience, like that you just really don't get as much here. And so we put the link across the board. I will add it once again to the chat. I also added Andrea's I also added Andrea's LinkedIn channel. Feel free to follow her where she documents a lot of gems across various topics. And yeah, so I don't see any more questions. Andrea, is there anything else you would like to add or places that people can find you on the socials? Up to you.
Yeah, yeah. LinkedIn is where I spend most of my time. I do hang out here on YouTube as well under the on the channel Mint Green Info or Mint Green Publishing is where you can find me here on YouTube.
And I'd be remiss not to add that once again, there is a $25 off coupon that expires the end of day Saturday, which is the 18th. So go ahead, take advantage of that. And you will be able to ask real live questions as they come up during the Brunch and Learn. But we're going to give you a session that is packed with not only good information, but actionable strategies that you can start to take. So as soon as the Brunch and Learn is over, you can start the process and, at least have a folder like I do that's ready to go as it relates to medical tourism. Yeah, something's going on, but you know what? I'm not even going to stress it. Not yet. You're right. Something's going on, but yes. So I want to thank you, Andrea. Looking so forward to your presentation during the Brunch and Learn series. I know you and I have spoken, and the fact that I know you did your homework. I know you did your research. The fact that, like I said, you were willing to take this trip alone if necessary um, makes me know that you were confident in the decision that you made. And so showing people how they too can get that confidence to do something similar if necessary. I'm excited to hear on the 25th. And so I just want to thank everyone for tuning in. Once again, share the information, hit the like button, subscribe to the channel, become part of the Gym Nation, y'all. And all you got to do is hit the subscribe button. That's how you become part of the Gym Nation. And catch all of these gems that we are dropping here for free as well. And so I look forward to seeing some of you in the session. Oh, YouTube is updating its format. Interesting. Andre, I'm so happy you are on the mend. We are sending you healing energy and love. Yes.
Thank you so much.
So thank you, one. Thank you all. Sorry, I don't know what the technical difficulties were, but hopefully, it'll it'll do what it needs to do. I'll slice and dice this up and repost it so that more people can see it. But thank you, everyone. Have a good evening. And again, have another plan. Go to bit.ly/have another plan so you too can be prepared. Because what do we do here? We stay ready so we don't have to get ready. And with that being said, have a good evening, everyone. And we'll see you on the next live.
See you later.